It is so difficult to be a new dentist. Paul, Dr. Nacho Goodman, and we're going to talk with the newest dentist, Dr. Carly here, about her journey through dentisting, the ups, the downs, the successes, the stresses, and most of all, times she's wanted to cry inside. Dr. Carly, tell us a little bit about your story. Start when you graduated from dental school and bring us up till now.
Sure. I graduated in 2015 from University of Florida. I then went to New York City and did 2 years of GPR, with the second year being a chief resident.
And I like to do this, Carly. I tell my wife this. I just interject with good ideas. I don't interrupt. But since I know there's many dental students out there thinking, do a GPR, don't do a GPR, go run out and work, don't work out. What to you were the benefits of a GPR, and would you recommend dental students do one?
Absolutely. I feel like in dental school, you're really nervous to just do anything because you don't want to fail. You want to pass the class. GPR, you just go in and do it. You have wonderful attendings there. You can push the limits a little bit more than in dental school. So
I want to share this, Carly. I always use the story. You know, your hair looks better than mine. I rushed down from my crazy family. But when you're in a GPR, this is the setup. The patients know you're there to be trained,
yes,
but you get to do a lot of the work. So the patient's expectations are that the residents are going to do the work and the attending is going to look over your shoulder.
Yeah.
This is not the same way in private practice or a DSO. Patients do not expect you to be training during the game. So if you went to get your hair cut and they said, oh, I have a question, I'm going to go get a more experienced stylist at a private practice hair salon, would you think that patient would lose confidence in their stylist?
Absolutely.
And in the GPR or the AEGD, they know it's normal to be like, hey, I want to go get Dr. Paul. This implant's going well, but I want to, and the patient, they don't get nervous, do they?
Nope.
Because they're GPR AEG patients. They're the most magical patients between the dental school lifers, which I should thank because we had 17 visits for a denture. So I wish I'd go back and thank them. Versus the pressure of private practice and a DSO is this magical middle ground. So I appreciate it. So you finish your GPR,
yes,
you're in New York City. Now it's like 2017. What happens next?
I signed a contract to work at a private practice in Binghamton, New York. So I would travel there on a Greyhound bus during the weekday, and then I would go back to Brooklyn on the weekends. That is because I could not find a job in New York City full time. I was working multiple part-time jobs. So the only job that I could find at that time was in Binghamton, New York.
So this is really important. And we have Dentist Job Connect behind here. And I want to share with you, Dentist Job Connect is a platform for jobs. So when we have a job in Center City, Philadelphia, Carly, there's 12 applicants in 1 week.
Yeah.
You have that same job in the middle of Pennsylvania, they struggle to find someone. So if you're a new dentist, pay attention as soon as possible. And I have to say, is the reality that there's not enough jobs and where most new dentists want to live?
Yes, but I also feel like you have to know where to look and what connections to have. I wasn't finding anything on Indeed when I was looking, or Craigslist, believe it or not. But I
The
feel
whole
like
thing's messed up. We go to school for 4 years, you're a GPR, go, how do I find a job? Just figure it out on the streets.
Yeah.
So the dentistjobconnect.com is the Indeed, but what you're sharing is it was worth it for you at that time in your life to commute for a better
Yes.
job. But I'm assuming that got to be a little much after a while.
After a year, I could not do it anymore. That's when I packed my car and moved to Philly.
So you come to Philadelphia and you don't really know anyone, but you do know this magical person, Dr. Ashley Dawson.
Yes.
Dr. Ashley Dawson is one of my favorite dentisting humans, parentheses around dentisting, just human beings. She came to our very first new dentist boost camp off the plane from Europe, very Ashley, said, I'm here, I want to learn. So she's very outgoing. And what did she say? You came to Philadelphia, what should you do?
You need to meet Paul Goodman from Dental Nachos.
And this is back in 2018-ish time. So Dental Nachos is much bigger then, but back then we had this small team. You came to visit me. I said, awesome. I love Ashley. You're now my friend. Ashley's my friend. We literally sat down across the table. I took out a white piece of paper. And what did I say?
You outlined different job opportunities for me, and you went over the pros and the cons for each opportunity and helped me make a decision.
Yeah, so give people the menu like our patients, tell them the pros and cons and say which one fits in your life. So you've worked for both DSOs and private practices. You share there's benefits and challenges to both. What are the benefits and challenges to private practice and DSOs?
Sure. I feel like with the DSO, they have a really good setup where you're going to go in, you're going to have a team, you're going to have the patient flow is the most important thing. They send you to courses, they pay for a lot of benefits, whereas a private practice, from my experience, there wasn't a lot of patients for months. So I was just sitting around. I didn't really have the support or the mentorship that I was hoping for, especially
And I
with
think
being
that's
new.
really a good point. DSOs have systems
Yes.
built in. Private practices may not have as many. It doesn't mean one's better, one's worse. As we talked about, working for a DSO, some of those challenges, did you sometimes get things from corporate, things you had to change without meeting the face who did those changes?
Yes, all the time.
So that doesn't happen many times in private practice. That's owner operator. So find the best fit for you. Taste test both, ask good people. That's what we're doing. And a lot of our things, it's a both world, private practice and DSOs. We're here in Center City, Philadelphia. There's corporate restaurants like Shake Shack. There's mom and pop restaurants. Learn about all of them. But then you came to my first sleep apnea and you met Dr. Ryan Robinson, someone that I helped learn how to talk to patients, someone I really admire as an entrepreneur, someone always growing. And what happened there?
I went to a Dental Nachos lecture and Dr. Ryan Robinson was there presenting all weekend. I was sitting in the front row. He was talking about sleep apnea, airway. I went back to my practice, implemented it right away with my DSO that I was working
So I'm going to give you
for.
a lot of credit because that's not easy. You
Yes.
said, hey, DSO group, I want to do this. And to their credit, they said, create a system and you can do it.
Yeah.
And you did create that system.
I did.
So you
Yeah.
were able to practice, if I use this basketball, you were able to practice the sleep apnea game, help a lot of patients inside of your DSO.
Yes.
That gave you some experience, some knowledge. But then what happened after that?
I really wanted to get out of the DSO. It was time. I was ready. So I remembered Dr. Robinson. He popped in my head. I Googled him, called his office, asked if I could come meet with him, went to his office. I was just really annoying. I'm like, hello.
Kindly annoying.
Kindly annoying. And then we ended up connecting really well and then started working alongside him for a few years. And here we are, our location in Pennsylvania where I work.
So he has one in Delaware.
Yes.
But people need help with sleep apnea and airway and team jam.
Yes.
So your location is where?
In Bryn Mawr, Pennsylvania.
And tell us, so it's in Bryn Mawr. What's the website for your location or the whole thing?
Sure, painandsleeptherapycenter.com.
PainAndSleepTherapyCenter.com. I'm going to take one of my family members there. And as you wrap up, what's been it like having a new business venture in the main line? I'm sure there's challenges. I'm sure there's rewards. Tell us a little bit about that.
It's definitely, I'm a business owner now. So there's things that I've never experienced before. You are doing a lot without, immediate gratification, but out there networking, just being at the office, more than I thought, but it's really rewarding because it's mine and I get to make the decisions and I have a wonderful partner that we just work really well.
And I love that. And I had a really amazing mentor, one of the best dentists on earth. His name is actually Dr. Andrew Halbert. He still is practicing the main line. And he said this to us as residents. I will never forget it. He goes, when you're an associate, you think you know everything. And then when you own a practice, you realize you don't know anything. So my thing, very much like Ted Lasso, would be to approach things with curiosity, not criticism as associates, unless someone's asking you to do something that's immoral, illegal, or unethical. So as associates, I would share that you may not always agree with exactly how things are being done. But if it's not illegal, it's not immoral, it's not unethical, test it out. Because when you become a practice owner, it's not as easy as people would think when you're an associate, right?
Not at all.
So I think that's awesome. Well, you are awesome, Dr. Carly. If you are talking to the next generation of dentists, which is a few years behind you, what's something that you wish you did or you think they should watch out for early in their journey?
Sure. I think that anytime that you have an opportunity for a job position, get that contract looked at by a professional lawyer. Don't try to do it on your own.
Don't DIY huge decisions because you will cry inside later. We talked about this, and since I'm far removed from this, I asked you, is it because new dentists are afraid? Is it because they are cheap? That could be part of it. But you actually said it's because sometimes the practice owner makes it seem like it's no big deal. Or tell us more about that.
Yeah, the way that it's presented, at least in my situation, was it's a very simple contract. Just sign it. It's very, doesn't almost like it doesn't really matter. Right. It's more for legality.
But then when you find out later, it matters.
It matters.
And I want to share with you,
sure.
you could be signing things that prevent you from buying the practice that you want.
Yes.
You could be signing things that come with tens of thousands of dollars of penalties. You could be signing things where people say you cannot work here. Just embrace this for a second. We're in Center City, Philadelphia. Imagine you're dating someone and say, hey, we ever break up, I don't want you to date someone on Walnut Street. That would be crazy, right? But that's what they do in dentistry.
Yeah.
They draw a circle known as a restrictive covenant and say you cannot work in these areas. So make sure your contract makes sense. Well, Carly, you embrace the ABC to FLA, always be connecting to feel less alone, of Dental Nachos and Dentist Job Connect. If we can help you in any way, please reach out to us. And like all good leaders, like all good parents, I was able to do this by bribing you with what?
Some nachos, of course.
Yes, I'm gonna take Carly for nachos after this. And this is, I actually learned this as I wrap up. I get a lot of parenting advice from TikTok, which sounds crazy, but they have amazing things. And I am a kid of the 80s. And we would tell our parents would tell us, I'm so proud of you. I'm so proud of you. I'm so proud of you. But it creates this weird dynamic of we always have to please our parents. So what I tell my daughters is, and they did, Daphne just started a play, you should be really proud of yourself. So Carly, you should be really proud of yourself for doing this. Awesome
Thank you,
job.
Paul.
Thanks so much, guys.
Bye, guys.